Now, here's your host, Stephanie Phelps.
Hi, everybody. It's time for another look. I'm Stephanie Phelps here with Anthony Brown. So glad you joined us. Hey, and Cynthia and Nicole are off.
Both of them off at the same time.
I think they're on vacation.
Again?
Again.
Okay, now see, when I leave again, don't say nothing.
Okay.
It's your turn. It's your turn to take a vacation.
You know what? I think you're right.
All right.
But before I do that, you know what? We, as usual, have some great guests lined up for you. And we have Vicki Whitmore from Whitmore's Barbecue. Yes. Also, Seth Wolf from the Free Clinic.
The Free Clinic.
Yes, and Stephanie Fall Creek and Marvin Retzer
Our friends from the Fair Hill Partner.
Fair Hill Partner.
Those are our friends right there. I love it when they come by.
I love it also, yeah, you know, and I love that name, Stephanie. Anyway, let's get started. In this first segment, we have with us Seth Wolf from the Free Clinic. And so good to have you on. You know, first time having someone on from the Free Clinic, so we want to know all about it. You're the board chair?
I'm the current board chair, and first, thank you very much for having me on.
It's so good to have you on.
Cool. You know, it's proper because the Free Clinic, I'm going to just spill the beans now and say because they're celebrating 40 years, in the community.
In the community, serving those who need health care the most, wouldn't you say?
Yeah, we just finished our sort of 40th anniversary party, and it was great. And yeah, it's been a long but enjoyable road with serving people who don't have any options for health care.
Okay, well, let's go back.
Okay.
Way back. Let's go back to 1970.
1970, yes.
When it started.
Yeah, the Free Clinic started in 1970 in a very small house on Cornell Avenue. And it was really started at that time by a group of folks who were part of sort of the counterculture movement that was going on back then. And the original patient load really focused on some of the young counterculture kids and a lot of kids with drug problems back then, which hadn't been seen a lot in the local hospitals. And you know, I think a group of folks had recognized that there was some stigma to that group of folks receiving care, and so that was really the impetus to start a comfortable place for them, where they could come, and it was very sort of ad hoc, not a huge amount of organization, and volunteers would come when they were able to and stay late hours, and take care of those folks. And as you move forward, you know, it really tracked healthcare in terms of who needed health care but wasn't able to get it in our community. And so after a while, you know, there really weren't a lot of, you know, young counterculture kids who couldn't get care anywhere else, and it shifted more towards just acute walk-in people who needed, you know, thought they had a sinus infection and needed to be seen but didn't have health insurance, didn't have access to a physician. And that's the way it's been. And now, you know, we see a little more than 10,000 unduplicated patients per year. So 10,000 people coming in for different things. And we've, you know, over the last few years, we've noticed a trend toward more chronic care. So folks, you know, for example, a person with diabetes who doesn't have access to regular primary care, you know, that to maintain their health, they really do need to regularly see a physician. And so we have a lot of folks who, instead of a once-a-year visit for something like a sinus infection, or they think they have a skin infection or some problem that's acute, somebody who's coming to us several times a year and sometimes more than that for management of diabetes, management of hypertension, chronic conditions like that. And along the way, we have started several programs for specialized populations where we saw a need. At the very beginning of the HIV crisis, we started one of the first testing places where people could come in and get anonymously tested.
So now, is there like an age limit or anything of for that nature for the testing, or is just whosoever will let them come?
No, we test for really all the major STDs, including HIV, and there's no age limit. You know, anywhere from teens to the elderly. We'll protect anonymity if that's requested. After we started the testing process for HIV, we then, as the, there was a time, as you know, where there wasn't any treatment. Now there is, and as soon as the drugs were developed that could effectively treat HIV, we started an HIV treatment center. So now we also treat a group of folks who have HIV and are living with the medications, and they get them from us.
Okay. Now, you know what, let's go back to the history just a little bit briefly again. You know, you said it started with the kids who were in the counterculture, that kind of thing. But as the time progressed, when did they start to actually have a board and decide that they needed a board? Because I'm thinking, you know, when it started, since it was counterculture, maybe they were kind of, I don't want to say having anti-board, you know, being anti-board, but that kind of thing. Do you know that information?
I believe it was still back in 1970 or 71. You know, there was a young lawyer named Charlie Clark who I believe was the person who helped incorporate the Free Clinic into a nonprofit corporation.
Okay.
And even back then, it did have, I think the first executive director, Gordon Friedman. There was a board. It was not as not as formal really as it's become.
Okay.
But I don't think there was a period where there was no organization whatsoever.
Okay. And just real quick, in the time that we have left, we've talked about the history. You've talked about what you're doing now. Where do you see the Free Clinic going in the future?
Well, it's a great question, and we are, as a board and with a lot of input from the staff and the community, looking at, what we want to be once healthcare reform hits. Because come 2014, there's going to be a lot of changes in who's eligible
shift in the
for
program.
what, and we want to make sure that we are positioning ourselves to continue to treat the people that we're treating now, and treat the people who are being left behind.
Okay. Well, Seth Wolf, thank you so much for being on from the Free Clinic. And right now, we're going to go take another look at the movies.